Welcome to Medical Licentiate Emerson channel. Today we are learning about Graves' disease. Graves' disease is an autoimmune disorder. It affects the thyroid gland. The thyroid is a butterfly-shaped gland in the neck. This gland makes hormones that control metabolism. Metabolism is how the body uses energy. In Graves' disease, the body's immune system attacks the thyroid. This causes it to become overactive. Graves' disease is the most common cause of hyperthyroidism. Hyperthyroidism is when the thyroid makes too much hormone. This can lead to many problems. These include rapid heartbeat, weight loss, and anxiety. Understanding Graves' disease is crucial for medical students and practitioners. It helps them provide accurate diagnosis and treatment. This essay will discuss various aspects of Graves' disease. These include its causes, symptoms, diagnosis, and treatment. We will also explore the importance of early detection and management. Graves' disease is an autoimmune disease. This means the body's immune system attacks its own tissues. In this case, it attacks the thyroid gland. The immune system usually protects us from germs and diseases, but in Graves' disease, it mistakes the thyroid for an invader. The immune system produces antibodies. These antibodies attack a specific protein on the thyroid gland. This protein is called the thyroid-stimulating hormone receptor, or TSHR. The antibodies bind to the TSHR. This mimics the action of thyroid-stimulating hormone, or TSH. TSH is made by the pituitary gland in the brain. It tells the thyroid to make thyroid hormone. When the antibodies bind to the TSHR, they cause the thyroid to become overactive. This leads to the production of too much thyroid hormone. The excess thyroid hormone disrupts the body's normal functions. This leads to the various symptoms of Graves' disease. Graves' disease can cause a wide range of symptoms. These symptoms vary from person to person. The most common symptoms are related to the overproduction of thyroid hormone. This is known as hyperthyroidism. One of the hallmark symptoms is a rapid heartbeat. Patients may feel like their heart is racing or pounding. They may also experience palpitations. Weight loss is another common symptom. Patients may lose weight even with a normal or increased appetite. Other symptoms include increased appetite, nervousness or anxiety, tremor, sweating, heat intolerance, fatigue, muscle weakness, frequent bowel movements or diarrhea, changes in menstrual cycles, and protrusion of the eyes, also known as Graves' ophthalmopathy. Diagnosing Graves' disease involves a combination of medical history, physical examination, and laboratory tests. The doctor will ask about the patient's symptoms. They will also perform a physical exam. This may include feeling the thyroid gland for enlargement or nodules. Blood tests are crucial for confirming the diagnosis. These tests measure the levels of thyroid hormones in the blood. The doctor will order tests for thyroid-stimulating hormone, or TSH, free thyroxine, or FT4, and free triiodothyronine, or FT3. The TSH test measures the level of TSH in the blood. TSH is produced by the pituitary gland and stimulates the thyroid gland to produce thyroid hormones. In Graves' disease, TSH levels are typically low because the overactive thyroid gland is producing excessive amounts of thyroid hormones, which in turn suppress TSH production. The FT4 test measures the level of free thyroxine in the blood. FT4 is the active form of thyroxine, a major thyroid hormone. In Graves' disease, FT4 levels are typically high due to the overactive thyroid gland. The FT3 test measures the level of free triiodothyronine in the blood. FT3 is another major thyroid hormone. Similar to FT4, FT3 levels are also typically elevated in Graves' disease. Imaging tests may also be used. These tests can help visualize the thyroid gland and detect any abnormalities. The most common imaging test is a radioactive iodine uptake, or RAIU scan. This test measures how much iodine the thyroid gland absorbs. Section 5. Ruling out other possibilities. Differential diagnosis. Graves' disease shares symptoms with other conditions. It's important to differentiate it from these conditions. This ensures accurate treatment. Other conditions that can mimic Graves' disease include toxic multinodular goiter. This condition involves the overproduction of thyroid hormone by multiple nodules in the thyroid gland. Thyroiditis. This is an inflammation of the thyroid gland that can cause temporary hyperthyroidism. Other autoimmune diseases. Conditions like Hashimoto's thyroiditis can initially present with hyperthyroidism. Distinguishing Graves' disease requires careful evaluation. Doctors consider medical history, physical exam findings, and lab results. They may also use imaging tests to differentiate it from other conditions. Section 6. Treatment Pathways, Managing Graves' Disease. Graves' disease is a lifelong condition, but there are effective treatments to manage it. Treatment aims to control the overactive thyroid gland and alleviate symptoms. The most common treatment options include anti-thyroid medications. These medications work by blocking the thyroid gland from producing too much thyroid hormone. Examples include methimazole and propylthiouracil. Radioactive iodine therapy. This therapy involves taking radioactive iodine orally. The iodine is absorbed by the thyroid gland, destroying some of the thyroid cells and reducing hormone production. Surgery. In some cases, surgical removal of the thyroid gland or thyroidectomy may be recommended. This is typically reserved for patients who do not respond to other treatments or have complications. The choice of treatment depends on several factors. These include the severity of the disease, the patient's age and overall health, and their preferences. Treatment often involves a combination of approaches. Section 7. The importance of early detection and treatment. Early detection and treatment of Graves' disease are crucial. This helps prevent complications. Untreated Graves' disease can lead to various health problems. These include heart problems. The overactive thyroid gland can put a strain on the heart, leading to atrial fibrillation, heart failure, and other cardiovascular issues. Osteoporosis. Excess thyroid hormone can weaken bones, increasing the risk of fractures. Thyroid storm. This is a rare but life-threatening condition characterized by a sudden and severe increase in thyroid hormone levels. Early diagnosis and treatment significantly reduce the risk of these complications. Regular medical checkups and awareness of the symptoms are essential for early detection. Section 8. Continuing the journey of medical knowledge. Graves' disease is a complex disorder. It requires a comprehensive understanding to provide optimal care. Medical students and practitioners should strive to stay updated on the latest research and treatment guidelines. Continuing medical education, attending conferences, and engaging in research are valuable ways to enhance knowledge. It's also essential to collaborate with other healthcare professionals. This ensures a multidisciplinary approach to patient care. By staying informed and engaged, healthcare providers can make a real difference in the lives of patients with Graves' disease. They can empower them to manage their condition effectively and live full and healthy lives. Section 9. Conclusion: Empowering healthcare professionals. Graves' disease is a common autoimmune disorder. It affects the thyroid gland and causes hyperthyroidism. Understanding its causes, symptoms, diagnosis, and treatment is crucial for healthcare professionals. This ensures accurate diagnosis and effective management. By recognizing the signs and symptoms, utilizing appropriate diagnostic tools, and providing individualized treatment plans, healthcare professionals can empower patients to live full and healthy lives. Continued learning and collaboration are essential for staying at the forefront of Graves' disease management and improving patient outcomes. Thank you for watching Medical Licentiate Emerson channel. Please subscribe and like this video.